Good morning, dear students. We have been discussing for the last 2 weeks the arrangement of artificial teeth in class 1, class 2, in terms of natural occlusion and longalized occlusion. And we've mentioned that the relation in class 1 is the upper maxillary arch overlapping the lower maxillary arch, and in class 2 this was the posterior relationship of the mandible to the maxilla. Today we will discuss the arrangement of artificial teeth in class 3. The anterior relationship of the mandible to the maxilla. In the natural teeth, the mesiobuccal cusp of the upper first permanent molar occluded distal to the mesiobuccal groove of the lower first permanent molar. While in class 3 complete denture cases, the lower arch is usually wider than the upper arch because of the anterior relationship of the mandible to the maxilla. In complete denture, class 3 cases, a normal relationship between the posterior teeth is maintained. That means the intercuspation is still the same. I mentioned for you, dear students, the dental technician should place in their minds that the occluding of the molar, the relationship of the molar in terms of class 2 and class 3 is the same as class 1. And the only difference will be with the setting of the lower teeth and mostly the anterior teeth. Now, in class 3 complete denture cases, the lower arch is usually wider than the upper arch because of the anterior relationship of the mandible to the maxilla. In complete denture, class 3 cases, our normal relation between the posterior teeth maintained. However, there is a little bit of crossbite situation frequently occur in the classification because of the situation of the mandible, the relation of the mandible to the maxilla, and this can either be unilateral or bilateral. Now, the image on the right side showing the cross-biting within the setting of artificial teeth in natural occlusion in class 3. This is perfectly normal, and the crossbite should be set up in situation where providing a normal relationship would mean placing the teeth off the center of the ridge, which would cause instability during function. Attempts should not be made to turn these cases into class 1 relationship. So, dental technician, do not try to set the teeth in normal occlusion. This will lead to cheek biting. So, leave it within the crossbite. And this depends on the arch. Mostly they are unilateral crossbite. In crossbite cases, the neck in crossbite cases, the neck of the upper posterior teeth should be extended buccally and the waxwork slightly overbold, as at the image on the left side. This to support the cheek and prevent them from falling into the buccal surfaces of the lower teeth and being bitten during function. So the crossbite, will be normally with the class 3. And to avoid cheek biting, the contour of the wax will be a little bit built up over the teeth to avoid the cheek to be entrapped between the teeth and lead to their biting. Now, this situation is the direct opposition of that scene for the class 2 cases. The lower teeth, now, the setting of the lower teeth will be opposite the case with the class 2 cases. Edge to edge contact is seen between the upper and lower anterior teeth. This usually also sees a situation where the place giving a little bit space left for the lower anterior teeth, which is greater than the width of the teeth chosen to match the upper anterior teeth. Okay? Now, as with the class 2, the anterior teeth keeping the correct size ratio between the upper and lower anterior teeth, and having extra numbers of teeth rather than wider one maintains better aesthetic. It is better to have 7 proportionally matching teeth than to place 6 larger teeth that are the wrong relationship to the maxillary anteriors. However, in some very severe cases, this is not possible while still allowing the force down to the long axis of the teeth during eating to be directed onto the lower ridges. Many technicians ignore this and provide dentures that tip when the patient bites through food. In these severe cases, it is better to copy that would have been the natural situation and place the lower anterior teeth slightly anterior to the upper teeth to allow pressure directed down through the lower anterior teeth to be directed into the lower ridge during the incising of the food. So, in this case, the lower will be wide, the upper will be narrow. Still, we have supernumerary teeth, many additional lower anterior teeth to be replaced, tilting the teeth slightly with inclination to make the contact edge to edge to avoid the incising or during the incising the pressure onto the long axis of the teeth. This long axis of the ridge. This will be a little bit different than class 2 and class 1, which have been mentioned previously within the last 2 weeks. In lingulized occlusion within class 3, class 3 jaw relationship are nearly the reverse of class 2 situation. The lower jaw is usually wider than the upper jaw, which means that in a large number of cases, either a unilateral or bilateral cross-bite situation is encountered, okay? In this situation, the lower posterior teeth are positioned over the ridges as normal. So the lower posterior teeth positioned over the ridges as normal. The upper teeth are positioned over the ridges in such a way that the buccal cusp occlude with the central fossae of their lower counterparts. Of course, to prevent cheek biting during mastication, a common problem for class 3 patients, the upper posterior teeth are tilted outward to make the neck of the teeth more prominent and buccally placed than the cusp. This has the effect of keeping the cheek away from the occlusal surface and also allows better contact between the upper buccal cusp and the lower buccal fossa. Now, to improve the contact between the teeth, a central fossa may need to be created on the lower first premolar for the upper first premolar buccal cusp to sit onto it. If this allows for some better to substitute the first premolar for second premolar in these cases. So either we modify the occlusal surface of the upper first premolar or we can substitute it with the second premolar. Now all the upper buccal cusps of the posterior teeth may need to be slightly rounded and the lower tooth ground to hidden the fossae to accept the upper buccal cusps. If the palatal cusps prevent lateral movement, the tooth should be inclined to prevent the contact or the cusp reduced slightly by grinding. Okay? Now, in extreme cases, that means severe class 3, the upper canines can be replaced by premolars to ensure that there is adequate tooth contacts and bring the occlusal table forward as at the image on the right side. This what we have within the setting of artificial teeth in term of natural occlusion and lingualized occlusion within class 3. Now, during our settings, the case of the patient different from patient to patient, and we have many points to put in our minds, like for example, limiting the occlusal table. Uh, Generally, within the restoration, we are looking for narrowing the occlusal table to make the pressure alongside the restoration into the underlying tissue. The occlusal table is the area of the function tooth contact. Attempting to reduce the natural occlusal table on prosthesis appears to make sense, but often causes instability of the denture due to the unstable loading of the teeth posteriorly. Now, a good analogy for this is when wearing skis, for example, and standing on a sloping surface. Inevitably, you start to move down the slope. When denture teeth that are placed over the sloping aspect of the posterior lower ridges are loaded with food bolus, the inevitable movement of the denture is forwards down the slope, leaving teeth off. This part of the denture leads to better denture stability. So, as a general rule, the second molar teeth should not be incorporated into the denture unless they can be placed over a flat, stable part of the lower ridge. So, to deal with the limiting space, limiting the occlusal table should be narrower. The last tooth should be within the most slopest stable area, and we can exclude the second premolar, of course. Now, dealing with the limited space, in terms of having limited space when we are setting the teeth, according to this theory or other theories, placing the posterior teeth in the most stable position often leads to the shortened dental arch situation. Positioning the large first molar tooth first and the lower arch can lead to reduced room for the premolars and lower anterior teeth. This can frequently lead to the situation where only one premolar, for example, can be placed in front of the molar. This is not a problem, as the major consideration when setting up the teeth, particularly the lower ones, should be the stability of the denture. So there is no problem to reduce the occlusal table, the limiting space, by removing, for example, first premolar and substitute it with only second premolar, and then place the molar, because the last slopest area was for the space for the molar. To try and decrease the length of the occlusal table, the upper canine can be exchanged for a secondary premolar. This will give a stable denture. The lower canine can then be said to occlude with the central fossa of this tooth, thereby increasing the length of the functional occlusal table by adding too many premolars. A simple alternative is to omit a premolar tooth and leave a small gap distal to the intact canine, in some cases, as in the image on the left side. Now, within providing stability in protrusive excursion, of course, the omitting of the premolar, the omitting of last molar, this gives sliding of the upper maxillary arch easily within the crushing of the food, which lead to sometimes instability, and the patient will feel the patients feeling that they losing their control for their dentures. So to provide stability in protrusive excursion in this situation where a long in case with the large, for example, overjet is present, it may be necessary to provide additional teeth to instability to ensure the stability in the protrusive excursion. And this mostly the premolar of the opposite side of the for example, we place for the lower behind the last molar, the second premolar of the upper left side, whether we are setting the teeth on the right side and vice versa. A premolar can be positioned behind the lower molar to ensure that the posterior contact is maintained, as in this image showing that the premolar actually maintained the denture during protrusive to the edge-to-edge relationship of the anterior teeth, and this is particular probably mostly within the class for example, class 1 and class 2. In this situation can be created in both class 1 and class 2 cases, and is particularly useful for class 2 skeletal relationship, where a large overjet is present. Because of the lower arch is narrow in class 3 and 2, and the maxillary arch wide, so this will be useful as the large overjet present. This will lead to the mandible to move freely. The positioning of this tooth in this particular position useful. This also routinely useful where the patient's condylar angles have not been recorded and may be larger than 30 centigrade. The angle of the condyle in terms of transferring this angle to the articulator, leading to Christensen's phenomena type situation being created in protrusive excursion. Now for the stability, in terms of stability, as I mention, dear students, the last tooth to be placed within the last stop in the lower, and the position of it will determine whether we are using the upper, the maxillary second premolar or not, or if we have a space for it, and whether this in class 1 or class 2 or in class 3. In many cases, lower denture stability is a problem. So to provide the optimal occlusal stability, the posterior teeth can be set to be parallel to the contour of the lower ridge, rather than at right angle to the occlusal plane. Okay? This ensures that the force exerted through the lower denture is always at right angle to the ridge, and helps to stable the denture rather than to dislodging it. Now, dear students, you may understand all the guidelines regarding the setting of teeth in terms of class 1, class 2, class 3 in natural occlusion and longalized occlusion, and whether these are many steps or factors should be determined, how to deal with the space, how limiting the occlusal table, and so on. Now, for the next week quiz, the question will be, how can you dealing with limited space and arranging of artificial teeth? Thank you for today, dear students, and be prepared for next week as well. Thank you very much.